All right, good morning. It is Monday, the 25th day of March 2019. I trust that you're well. Thank you very much, as always, for joining us on My Doctor. My name is Winnie Lubembe. Now, more people die annually from cardiovascular diseases than from any other cause, and an estimated 17.9 million people died from cardiovascular diseases in 2016, representing 31% of all global deaths. And of course, of this, 85% are due to heart attack and stroke. And over 3/4 of cardiovascular deaths take place in low and middle income countries. And why is that? Well, stick around till the end of the show. Of course, we'll be answering some of those questions. But as always, if you have any other question, then feel free to call us live. 0791-478990 is the number to call in. Or alternatively, you can send us a text message on 40975 with your question, and we'll answer it as soon as we get it. And today we'll be focusing on heart attack. I just realized I didn't tell you the topic of discussion before I told you to call in, but yes. So today we'll be focusing on heart attack, and again, we're live. So call in if you have any other question. Again, the number is 0791-478990, or alternatively, send us a text message on 40975. So before we get into all the discussion, of course, to help us understand more on heart attack or myocardial infarction, I am joined by Dr. Gabala. Good morning.
Good morning.
Thank you very much for making time for us today
Thank you
on My Doctor. And before we get into the discussion, so that the people can familiarize themselves with you, kindly introduce yourself.
Well, my name is Mohsen Gabala. I'm a consultant interventional cardiology working in MP Shah Hospital in Nairobi.
Okay.
And I came to Kenya now a month ago. Before that, I was in England for 12 years.
All right.
And in Canada, and before Canada, I did my graduate schools in Sweden, Stockholm.
Right. Okay. The perfect person actually to discuss this. And you know, we have a lot to discuss as far as heart attack is concerned. And you know, this is, I mean, we hear it day in, day out. People talk about heart attack, or someone had, you know, heart attack and all that. So can we just go back to the basics? What do we mean when we refer to heart attack?
Well, heart attack is when there is a complete cessation of the blood supply to the heart muscle. So the heart is the pump in the body, and it works 24 hours, and it needs a lot of blood.
Right.
Unfortunately, it contains the blood, the heart contains blood, but it has to get blood from blood vessels outside the heart. And when there is a blood clot in one of the arteries going to the heart, so there is a complete stop of the circulation to a certain area of the heart, and that area will die eventually, and it will cause severe pain, severe chest pain.
All right. And can we briefly talk about the structure of the heart so that we understand, you know, because you said the heart has blood, but now it also needs blood from other, you know, parts of the body. Yeah, so very briefly, the structure of the heart, and when this blood that is not from the heart, where does it come from, and how does it circulate in the heart before it gets to the brain and other parts?
Right. Well, it is a phenomenal structure, the heart, because it is a pump, the same like any engine of the car. So it is pumping blood all the time, 24 hours, as I said. Sometimes the heart rate, which decide how many beats per minute, it goes up if we are running, if we are under stress, and that will increase even the need, the metabolism increase inside the heart. So as I said, the heart is like a chamber, it's a chamber, and it contains blood. But the blood inside the heart cannot do the function to give nutrients to the heart muscle. So the heart gets the blood from outside the heart, because once it contracts the heart, so then all the circulation inside the heart becomes like zero, and it cannot take blood at that time. So the blood has to come outside, which is called coronary arteries, because it's like a crown on the head. There are three major vessels which cause the heart. One on the left, which divides into two, and one on the right. The left coronary artery gives the blood to about 75 to 80% of the heart. The right coronary artery gives about 15 to 25%. So the heart, in order to work, the same like the engine, needs a battery, and there is a battery within the heart itself. And that battery is causing the electric impulse to spread all over the heart. if the battery has problem, or if this area with the battery of the heart exists, and there's a heart attack, the battery will stop be working, and there will be impulse disturbance, which can cause cardiac arrest, for example.
All right, okay. Now, we have different terms, all right? We have heart attack itself, we have cardiac arrest, and we have heart failure. Do they mean the same thing, or there's a difference?
Well, actually, all of them, because of the heart, so it starts in different stages.
Right.
The first stage, it's a heart attack. So the heart attack is actually very common in most of the world, and you mentioned that we have very high mortality rate. A lot of people dies, and before I came to Kenya, I thought that okay, in Kenya people are more active, they eat a lot of vegetables, but actually it's not. It's the same percentage equal to Western Europe.
Yeah.
Even though it happens at a younger age in Kenya. So I had, for example, few patients. One of them was 20 years old, and he has been complaining of a chest pain for more than 2 years. He thought that could be just muscle of the heart, of the chest. And when he came, all his 3 vessels were blocked. So it took maybe 3 hours to open. So the heart disease are very common, and it all starts with the amount of fat in the blood. So the fat circulating in the blood, it goes to the coronary arteries and build what's called plaque, or atherosclerotic disease. That plaque starts to increase with time until it becomes to a stage when it ruptures, it causes complete blockage of the artery.
All right.
And then it happens heart attack.
Okay.
Once the heart attack happens, becomes a fibrous tissue in the heart muscle, and it's not working anymore, this part. If it happens at several occasions in different sides of the heart, so the heart pump function will be affected, and then the patient will go into heart failure, which has very bad prognosis, because still we are trying to do a lot of research to find new drugs, but still we are not there at the time that we say that everything is fine.
Okay.
So ultimately it increases the heart failure. It's like it's a vicious circle. If a heart failure, it causes more damage to the heart muscle, until ultimately we have to do heart transplantation to give a new heart.
Yeah.
So that's what called with heart failure. And heart failure has very bad prognosis, even compared to cancer, is worse than cancer to the patient.
Okay, and that is where we're saying prevention is better than cure. Like before we get there. Now, how long does it take between heart attack and heart failure? Do we have a specific amount of time or does that depend on age and other factors?
It's a very good question, because actually it can happen from 1 minute up to a couple of years.
Okay.
Because if the artery going to the heart is one of the major vessels, and it gets blocked, then the large area of the heart, we call it like jeopardy index.
Okay.
And we measure that with echo when the patient comes to us. So if it's more than 50%, this will cause acute heart failure, which is cardiogenic shock as well. And it has very bad prognosis, like 50% of the patient, unfortunately, wouldn't make it.
Yeah, all right.
So that happened in the acute stage, when the patient have chest pain, and then he fainted, there's some electrical disturbance or low blood pressure. Those are the criteria to classify the patient into cardiogenic shock.
Okay.
But if the patient manage the acute stage, and we manage to open the artery mechanically in the cath lab by doing a PCI or stent, then we give medication to prevent that of happening, to prevent heart failure of happening. But once heart failure is there, then it will give symptoms, and then it will start the progress. We try as much as possible to halt that progress with medication.
Okay. All right. So what exactly causes it? Because most of the time we hear these cases mostly in adults, like people of older age, I would say. And most people would say, oh, well, that is because they're aging. I mean, they're also probably some of the organs are starting to shut down slowly.
Actually, yeah. Actually, there's no age within cardiology anymore. So even in England, I had a patient, I remember, that she was 99 years old, and she came with a heart attack. She was very, otherwise she was very healthy, and she wants to live until at least she become 100 and get a telegram from the Queen. So actually we did an angioplasty. We opened the artery, we put a stent, and she managed very well.
Okay.
So there is absolutely no age limit. If the patient has the ability to accept the treatment and we know that the patient will take the medication, we will certainly try to open the artery which is blocked. There are certain factors which actually affect not only elderly people but even young patients as well. So high blood pressure which is not treated well, that's a risk factor to have a heart attack.
Okay.
High cholesterol, which is a lot of blood fat because of the food we're eating, because of the takeaway from Kentucky or from other restaurants with chips. So that will increase our cholesterol, and the cholesterol in the body, it goes to a certain limit. When it passes that, then the liver cannot maintain the fat. So it will go into the arteries, coronary arteries, and then start to cause atherosclerosis.
Okay.
There is diabetes, smoking, alcohol. So all these are common risk factors. So if anyone have those risk factors and complaining of a chest pain, he has to see a cardiologist as soon as possible.
Okay. Now, in terms of the limits, what is the limit exactly? And I'm asking this in terms of the food that we eat, because people would argue and say, for instance, the chips, and let's just say unhealthy foods. Some people might say, well, but I take it maybe like once in a week or twice in a week, so probably am I on the clear, or am I still at risk of developing heart attack and eventually heart failure? So in terms of the limit, what exactly is it? And depending on the food that you eat, let's say like once in a week or probably twice in a week, will that have an effect eventually on you developing heart attack and heart failure?
Well, it's not only what we eat, but some people and some families, they genuinely have high cholesterol because they are lacking some of the enzymes. And we can see that the whole family, that they are affected by heart disease or acute heart failure, acute myocardial infarction, and then it goes in family because they lacking the enzyme which actually will destroy the cholesterol.
Okay.
Other people, it depends on the stress. We have acute stress and we have chronic stress.
Okay.
Stress, generally, it will affect the metabolism of the cholesterol metabolism in the body. The lack of exercise is very important factors. And even before I start to tell the patient what to eat. So I always ask him about exercise. So if you have a lot of stress, you have to neutralize that by increased exercise. And when we talk about exercise for the heart or the cardiac exercise, it's 45 minutes, at least 5 days a week.
Oh, wow. Okay.
So that's the thing that we can keep our heart and our cholesterol level low. But again, back to your question, what is the best level for cholesterol? And I will tell you that there is no limit.
Okay.
If the patient have cholesterol at 5, for example, and he had heart attack, we have to lower it to 3. If the patient have a high cholesterol at 7, then we have to lower it below 5.
Okay.
So it's relative, but normally I would say any cholesterol above 5 should be treated before it happens. And it leads to heart attack. Okay.
Now, and in terms of our children, because right now we see so many children who, one, are very inactive, and two, the kinds of food they eat. And someone might argue and say, well, they go to school, they are active a little bit, but from what you said, 45 minutes of exercise, at least 5 days a week is recommended to prevent you or help you, minimize your chances of getting heart attack and eventually heart failure. Now, but for the children, what happens? Because we see so many cases of obesity among the children. Is this detrimental to their health later on in life, or they could also get, some of the symptoms of heart attack early in life?
It is a big problem, at least in the Western countries. They actually start to focus the interest on the children. I mean, it's partially because our problem that we give the iPhone, the iPad to the children, and instead of going out and playing football in the field, so they are sitting in front of the video games or the TV, and they start to become more sedentary, more inactive. And that will lead to a lot of obese children, and they will have the same risk factors as adults will have about 20 years later. So the youngest child or youngest adolescent that we have with acute heart attack, he was 12 years old.
Oh,
And and unfortunately, when they have a heart attack, it's not the same like the adults.
An adult,
So it is massive heart attack, and it always associated with a cardiogenic shock or cardiac arrest. So if they come on time, we will be able to save them. But unfortunately, a lot of parents, the even culture, think that they feel that if the child is a little bit obese, that means that he's healthy. But it's not, the case. If he's obese, that means that he is really sick, and we have to attack that problem early in the course of his life.
Okay, all right. Now, what are some of the symptoms, and is it different between men and women in terms of some of the symptoms of heart attack? All right, so what are some of the symptoms?
So we always say that a woman in the childbearing period until 40, 45, before she develops a menopause, she's actually 10 years younger than the man in the same age. So I would say that if the female is about 40 years, that means that she's equivalent to 30 years male in the prognosis and the incidence of heart attack. Unfortunately, once the women start to smoke, this 10 years protection disappear. And after menopause, there's no difference between men and women, so both of them will be affected. I would say that the prognosis in women is a little bit worse compared to heart attack in men. It seems like women tolerate a lot of pain before she goes actually to the doctor. And we always say that time is muscle. So once it's a chest pain, it's very important to go to the hospital on time. Every time passes, every half an hour, about 30% of the muscle of the heart dies. And if it dies, it doesn't come back. And it will go into the heart failure, it will go into other problems. So women presenting symptoms a little bit different than men. They can come with a breathing problem, no chest pain at all. Because of pregnancy, so they are used to pain. But men, if they got like any kind of pain, he will run to the doctor. Women tends to stay at home. She's needed more at home than men. So, and that's what makes it the worst prognosis for women, because they come late compared to men.
Compared to the men. All right. Now, in terms of the chest pain intensity because there's some people who have other respiratory diseases, and sometimes they might tend to, let's say, confuse it for something else, like for instance bronchitis and all that. So in terms of the difference, so that someone knows that when I have this particular type or intensity of pain in my chest, then this is a symptom of heart attack and not of a respiratory disease. So in terms of the difference of the intensity, how would you say for heart attack is?
Well, it's very different as well, and the pain normally, it depends on the perception of pain. It depends on your psychological state. So if we are so happy, we are, like for example, I can tell you the heart attack or patient coming with heart attack during Christmas is much less compared to other parts of the year. Because people, they have chest pain and they're sitting with the whole family gathering and they don't want to leave that moment. So they said, okay, I will tolerate that pain. And then they start to take a lot of pain relief and not to come to the hospital. Once they go away, so they come to the hospital maybe 2 days later with other problems. And the same as well, we know from wars, like a soldier in the middle of the war and we get to pull it and then he just put it out and then he start to fight again. Other people, if they just get like the nail broken, they start to scream. So pain perception is completely different for different people. But we not only go after the pain, any alarming symptom from the chest, we always take ECG. And then in the hospital, in casualty, in MP Shah, even before they talk to the patient, and once they hear that it is a chest pain, the first thing they do that they take ECG, and the ECG will give us the idea if there is any heart attack ongoing or not. So it is very important to be quick to take care of those patients. They will not be sitting outside waiting. But the answer for your question, the pain is completely different among people.
All right. So now let's go back to the women and the symptoms. So we talked about there's an aspect of chest pain. I would also imagine that is also the same case for the men. But now let's start with the women. So there's an aspect of chest pain and then difficulty in breathing. Any other thing that people should be concerned about when they have it that could be the telltale signs of a heart attack? Yeah.
Well, it could be different symptoms, of course. So there is women coming say that I don't feel well, and that's it.
That's it. Okay.
And then we have to look everywhere until we do the ECG, and then it shows the heart
All
attack.
right. Okay.
Other people, they have pain in the back, not in the front of the chest.
Okay.
Sometimes it comes in the abdomen, and it's not actually uncommon that those patients goes initially to surgical department, and then they come back again to us, and of course there is a delay. Other women, they just faint. Just faint, and then they wake up, and then they come to us, and they don't have any pain at all.
Yeah.
And as I said, it's a blood test, it's ECG, so it's a lot of diagnostic test to be able to come to the diagnosis as soon as possible.
Okay. All right. And what about the men? Chest pain again?
Men is different.
Okay.
Men
All right.
always
So what are
clear
some of those?
on the symptoms. I have pain here, and I think I'm feeling that I'm going to die.
Okay.
So this feeling, actually, this is the typical symptoms for acute heart attack. And it just tells you, okay, please take an ECG and just start the treatment. I didn't mention the treatment, but the old days, we actually used to give a clot buster agent, like a medication intravenous, to dissolve the blood clot. But the studies now, they show that if we go mechanically with a balloon and open the clot or suck it out from the coronary arteries, and we put a stent, this has much better prognosis.
Okay.
And that's what we are doing in the hospital at the moment.
Okay. So, of course, we'll also talk about the treatment in depth later on in the show. But now, so we talked about the symptoms vary, and this is between men and women and between different people.
Yeah.
Do we know why? I mean, is it cases of, let's say, immune system, or what exactly differentiates, let's say, pain, the amount of pain, or the, kinds of symptoms between, different people?
Right. Well, it depends on the way actually the person is. It's different between different persons, but categorically we say that men and women, but even in men there's different level and the different types as well. So pain perception, when we have any pain, so the impulse goes to the brain. So, and in the brain happens a lot of things. As I said, if you are busy, then you will try to stop those impulses to move or to go to the hospital. So, for example, if you are in the middle of something and you have pain, so you will just continue. And then you will feel the pain afterwards. And the other people, they have different perception as well. So other people, when they are depressed, that can even cause the little pain to become huge or gigantic because they don't feel well. So pain, and the worst thing is the spiritual pain, which is like depression, for example. So that's if a patient is depressed, so any kind of pain will make a big symptom or a gigantic symptom. So it depends on the state, the state of mind, the actual, if the patient have busy work or have in the middle of something in the family and doesn't want to be burdened. Women tends to feel always that they are causing burden or problem to the family, and they want to step back and to keep the pain for themselves for a long time until it becomes unbearable, and that's too late sometimes.
Okay. All right, so it's very easy. Like I like what you said. As soon as you feel some sort of chest pain, just go and get checked.
Exactly.
It's better to go and you're told, you know what, it's nothing serious, other than you wait until it's too late. Okay. Now, are there some silent, let's say, signs of heart attack? And I'll answer this in relation to, remember we said there are different stages, the heart failure, and then there's the cardiac arrest, and then finally there's heart attack, cardiac arrest, and then heart failure. Yeah. So are there some of the silent
Yes, there is what we call silent ischemia. Okay. So ischemia means that the gradual stoppage of the circulation going to the heart. Sometimes it happens acute or gradually over hours or over days, over weeks. And some of these ischemia or the pain in some patients, like for example diabetic patient. So what happens in diabetic patient, that the nerves which takes the pain stimuli from the heart going to the brain actually becomes affected by the diabetes, and they are not working properly. So those patients with diabetes, sometimes they feel very strange feeling. Something happened in the chest. It's not pain, it's nothing. Sometimes as I said, they can have only breathing problem, that they start to walk a little bit, short distance, and they get very breathless. But no pain. So the symptoms can variate, and it depends on the different other conditions. But yes, silent ischemia can happen. How do we know that it happens? If anything abnormal, even palpitation or anything from the heart, I wouldn't wait. Just even if they come a little bit unnecessary, but just to check, and then if everything is fine, they can leave with a certain information that everything is fine with the heart. It's better.
Not meaning to scare the people, but that sounds really, really scary, in the sense that sometimes we have cases where you feel your heart rate is a little bit faster for some minutes or hours, I would say, and then after some time it goes back to normal.
Yeah.
Should we be alarmed if that happens?
No, because our heart rate is not stable at a certain point. Sometimes if we get like frightened, or if we get very happy, or if a girl looking at a boy, and then, or vice versa, and then he's beautiful too, of course our heart will start to pump a little bit quicker. But it takes some time, and then it goes back again to normal. But if it happens every day, on a daily basis, many times a day, then it is not the normal physiological process. So it's something different, and then I would definitely recommend to go and to check the heart rate.
And what about those people who say they feel some really sharp pain at the back? And you mentioned something to do with that as well. So should this also be, like, let's say if it's on a daily basis, then should they be concerned? Or let's say once in a while and then it disappears, it could be a sign of something else?
Yeah, unfortunately, back pain is very common. And it's not all back pain comes from the heart. So we know that it's a chronic problem, and it's one of the highest cause for to be on a sick leave, even in Europe. So the back pain, which is coming from the heart, is not related to movement per se, as if you turning in the bed and then it causes some spasm or muscle pain in the back. It's not the heart. So the heart is inside the chest, and it is protected. But if the patient is running or going uphill or doing any physical exercise, and then he get pain in the back between the shoulder blade, this gives the impression that it could be something from the heart. What we normally do, that if we take ECG at rest, normally there will be no pain, and the ECG will be completely normal. So we have to actually put the heart into action to see what the heart and the ECG looks like when the patient is running, for example, on a treadmill. And that's what we call stress test. So we take ECG at rest, and then we ask the patient to start to walk fast on the treadmill, and we take another ECG after that.
Just to see the variations. So we need to take a very short break, but of course when we come back we'll delve deeper into the diagnosis and the test, and what exactly happens during that time, how long does it take, and then before we get into the treatment part. But again, if you have any other question, then feel free to call us live. 0791 478990 is the number to call in, or alternatively send us a text message on 40975 with your name and your question, and of course we'll answer it as soon as we get it. We'll see you on the other side of the break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and just in case you're tuning in right now, today we are focusing on heart attack, and something that we've been hearing people talk about every single time, and that is on heart attack. So today we're delving deeper into what exactly is heart attack, some of the signs and symptoms, risk factors, of which we've covered pretty much on the first session of the show. So yes, stick around till the end of the show, of course, get to learn more on the same. But if you have any other question, we're live. So that means you can call in right now and ask your question, and of course we'll answer it as soon as we get it. The number is 0791 478990, or alternatively send us a text message on 40975, and we'll also answer your question as soon as we get it. Now, Dr. Gabala, we were to talk about diagnosis, and I know pretty much you've mentioned a little bit when we started the show, but just in case someone is tuning in right now and thinking, okay, so I might have some of the signs and symptoms, that is chest pain, shortness of breath and all that. So what happens during a diagnosis session, and how long does that take?
Well, before the heart attack, sometimes there is a prodrome or another stage which is called angina pectoris.
Okay.
Angina in Latin, it's a pain, and pectoris is chest, which means chest pain.
Okay.
So not every chest pain is heart attack. So the duration of the chest pain is very important. So if the pain is less than 15 to 20 minutes, then it is not a heart attack.
Okay.
So we call it angina pectoris. It's not as serious as heart attack. So chest pain more than half an hour, yes, definitely heart attack, or even if it is severe chest pain with other symptoms like sweating, shortness of breath, and the patient actually in agony or in pain.
Okay.
So if we say that from 1 to 10, 1 is very little pain and 10 is severe pain. So they are normally 8 to 9. Why the angina pectoris patients, they are between 1 to can go up to 4 or 5 as maximum.
Okay.
So that's the difference between angina pectoris and acute heart attack. If we start about how to diagnose angina pectoris, it's very important the history, what the patient tells us.
Yeah.
Then after that, we take ECG. At rest, if it is normal, we will do the treadmill test, and we will see what is the heart act when it is under stress. And finally, we can even, or the golden standard of diagnosis is to do an angiogram. Angiogram is not as dangerous as it was in the 10, 20 years ago. So we do it on a daily basis, and it takes 5 minutes, which is X-ray with contrast to the coronary arteries. And that's what will tell us if there's any blockage in the, or not total blockage, but at least narrowing or stenosis. Then we can just open, and then the problem is over. For the heart attack, it's severe chest pain more than half an hour. We take ECG and we see changes on the ECG, which tells us that this is heart attack. What we do is, as soon as possible, we have to run the patient to the cath lab to open the blockage or to open the blocked artery and to put a stent, and then the problem is done. Then some medication for afterwards for a few months, and then everything will be fine.
Okay. All right. Now we have a question. This is Jelita from Eldoret. I think my director will help me with the question now. She's saying she has a child and she was born with 3 holes in the heart. So she went to a hospital and they did the surgery, and the open heart surgery rather, and they managed to close, I think, 1. No, it wasn't. They didn't close it. Okay. Okay. All right. So they didn't close any of the hole, and they told her they will call her, but now they haven't called her until now. So she's asking, does she have to also go back for another open heart surgery, or is there any other procedure?
Well, a hole, not all the holes inside the heart has to be corrected surgically.
Okay.
So there is, if it is on the atrial side, which is, we know that there are 4 chambers in the heart, the 2 atrium, they are smaller chamber, and the 2 ventricle, which is larger chamber.
Okay.
If there is a tiny hole between the 2 chambers, normally we leave it, we don't do anything because it's compatible with life, it doesn't cause any problem. If there is a hole on the atrial side, there's different types of the holes, it depends on echo. So ultrasound scan should be done.
Okay.
And if we see that the hole causing a lot of shunt of the blood to the right side of the heart, causing problem, then we have to intervene.
Okay.
Normally, in the old days, we used to do open heart surgery, but now we can actually go in and close the hole from outside by a special device, and the problem is done. So it depends on the symptoms. If he has absolutely no symptoms, it means that the hole is not large. And she can wait and she can go for echo examination on a regular basis. But the problem is once the patient forget the control or the regular checkup with the echo, and then goes like 5 years, and then happens the problem, then it can be too late. So that's why the main advice is to stick to the doctor and to get echo once a year.
Okay.
Even if the patient is asymptomatic, has no symptoms.
Okay, all right. Now we also have another question, and this is Paul. And Paul says, "Hi, my doctor. I'm Paul, watching the show from Mombasa. Is it true that coughing multiple times when experiencing symptoms of a heart attack can better the prognosis before reaching the hospital? Is there any first aid that can be done when one is having a heart attack?" So two questions in one.
Well, it is a smart question, actually, because he must have seen it either on someone alive. But normally, when the patient in the acute stage of heart attack, they mentioned they can have electrical disturbance of the heart. So the heart rate suddenly goes from 60 down to 20 or 15, which is not compatible with life. And before the patient goes into cardiac arrest, we always tell him, okay, try to cough. Try to cough all the time. And once he coughs, it goes up again.
Okay.
So it is a reflex from coughing to the heart. So when we cough, it makes the heart to start to work a little bit rapid, because maybe when you cough, you need a little bit more metabolism in the chest wall. But this has nothing to do with the heart attack. So it doesn't mean that if you are coughing all the time, that will protect you. It's only you have to see that there is disturbance of the electric impulse, and then you will ask the patient to cough at that time.
Okay. And his question was, does it better the prognosis before you reach the hospital?
Yes and no.
Yes
It
and no.
depends on,
Okay.
it depends on the heart. If the patient is monitored and there is a heart rate which is dropping down, yes, it might help. But at least you have to know, because it could be just the blood pressure and had nothing to do with the heart rate. So if the heart rate is very slow or even very rapid, what's called VT, yes, coughing is very important at that time. But all the ambulance crew and the medical crew, they know those things, and they will ask the patient immediately to cough.
Okay. All right. And then his second question was, is there any first aid that can be done when one is having a heart attack?
Say it again, sorry.
First aid. Is there...
The first aid?
Yes.
Right. If the patient, of course, it depends on how the patient. The first thing is to have to calm him down. The problem is when a patient suddenly faint or he drop down, so there will be a lot of people just coming and standing around, just looking, doing nothing. So first I have to give him some air, some oxygen, and of course if you are out in the streets, that's the best air. But once people start to come like a ring, it actually diminishing the air around the patient. And to assure him that, and to calm him down, say that everything is fine. Of course, if the patient stop breathing and then he goes into cardiac arrest, and you are trained to do CPR or resuscitation, of course the best thing is to start to push down and to do cardiac massage, because that's the most important thing until the ambulance crew comes and see what is the problem with the electric signal, and if they give a defibrillator or not, and more advanced ALS or advanced life support. But the life support done by normal people out in the streets, the best way is to do cardiac massage.
Okay.
Breathing, some people will be a little bit more conservative to do mouth-to-mouth breathing, because you never know the one in the street if you have any communicable disease or anything. And actually, most of the research said that the mouth-to-mouth breathing is not as important as cardiac massage at that point.
Okay. All right. Now, what about those people who would come and just hit you on your chest, just like once, very hard? Does that help, or is it dangerous?
Again, we used to do that as it's called a precordial thumb, which is have to be firm and have to be down. But you have to see the ECG monitor at that time. You can't do it without knowing the thing. Some people say that if you don't have the monitor and you know that it might help in only 2% of the people, maybe that patient will be one of these 2%. So just do it before the ambulance comes. But actually, the thumb can cause even more problem towards other things. So we don't do thumb without any monitor of the heart rate. And once we see that there is a systole or no activity, then we will give that firm. Sometimes it helps as well with VF. But normal people, if you get another patient which is completely normal and you hit him in the chest, actually that can cause cardiac arrest as well.
Yeah, okay. So don't do it if you're not trained.
No, I wouldn't recommend to do it as a routine. You have to have a heart monitor, and you have to know what you are doing.
Okay.
The most important thing is compression, to compress the chest hard and vigorant to get actually the heart towards the heart to try to pump the heart.
Okay. Yeah. How many compressions is it advised?
Well, it's recommended to be like between 60 and 70. So it has to be firm and it has to be regular. But once you have another one who help with breathing and you got a mask, so you can do a 15 compression, 2 breathing, and then go on again. But compression is the most important in that stage.
Okay. All right. 2 questions. This is Stella from Eldoret, and she says, my heart beats fast when I eat sugary food. What could be the problem?
There is some stimulation. I remember a pilot in Sweden, actually. He was working on a line between Stockholm and New York. And he told me that every time his wife making potato, he faint, or he got palpitation and then he faint.
Okay.
And I couldn't find any connection between potato or sugar in her case and the heart rate. But yes, there is some food which can affect actually through the vagus nerve the heart.
Okay.
Because when we swallow, so that there is a reflex which will give signal to the heart to change the heart rate. It depends on different things.
Okay.
But for that pilot, what happened that we put 24-hour ECG monitor, which is called Holter, and he went out with that heart rate for 24 hours. And then when he came back, we put it on the computer and we analyze every signal. And we saw that he has actually a pause of activity of about 7 seconds. So there's no treatment for that apart from putting a pacemaker in that patient, and he became fine. Unfortunately, he couldn't fly anymore because of the pacemaker, but at least he's still alive.
Okay. So for Stella's case, what could be the problem, and what does she need to do?
There is a lot of disease, very common, especially in women. It's more represented in women. It's kind of like related to the hormones cycle every month and the premenstrual tension. Sometimes it causes the blood volume to increase, and that will make the heart to beat faster because the heart sense the volume of blood. Once the volume increases, the heart has to work a little bit harder. So, but all it depends on the diagnosis. So there is more than at least 25 different diseases which cause disturbance of the heart rate. Some of them need treatment, others need just to reduce the alcohol, coffee, tea,
and sugary
and the sugary food, sleep well in the night, not to say late in the night. All this will affect the heart and it will cause palpitation as well.
Okay. So can she try probably avoid, let's say, some of the sugary food, and then if it doesn't help, probably just go to a hospital and get
exactly. Yeah. Okay. If she just stop eating sugary food, she will not have palpitation.
Okay.
Yeah.
All right. And now this another question, and this is just short and precise. What causes bruit? Is it bruit? B-R-U-I-T.
B-R-U-I-T.
Bruit. Yes.
Oh, bruit. That's a French name.
Yeah. Okay.
So the cause for bruit it's a blood flowing very quickly through a valve inside the heart, or blood turbulence flowing into a very narrowed heart valve. And it's called bruit, which is noise in French. So when we hear noise, when we listen with the stethoscope and we see that there is noise, so we have to do ultrasound scan to see what is the problem. If it is physiological, normal state, or there is a valve problem that we need to intervene, or there's a valve problem that we can just follow up and continue medical treatment. Okay.
All right. Now let's briefly go into now the treatment of heart attack. I think we can start with heart attack, cardiac arrest, and then eventually heart failure. What are the treatment options?
For heart failure?
Yes. So we can start with heart attack.
With heart attack?
Yes.
So the treatment option, because of the heart attack, it's a blockage in one of the arteries, is the best treatment is to open the artery as soon as possible. So what we do, we take the patient to the cath lab and we just have a quick look on the arteries to see which artery, which is the culprit. We open the artery by sucking out the blood clot and we put stent in the place, and then the procedure might take between 20 minutes up to 1 hour. It depends on if it's only one artery or several arteries.
Okay.
So that's the best treatment for heart attack. Then we have actually, it's not the end, but we have to look why it happened from the beginning. Does the patient have diabetes that he doesn't know about? Does he have high blood pressure? Does he have any high cholesterol? So we treat all these conditions and all these risk factors at the same time.
Okay.
For heart failure, it's only medical treatment to start with. So, so the patient have a weak heart muscle. That weak heart muscle does not manage to pump the blood normally. And if we drink a lot of water, then we are increasing the amount of blood volume and it will be even more problem. So we are worsening the problem. So what we treat, there are different medication or different treatment and the tablet for that. So first, they have a lot of water in the body because the heart is not pumping very well to the kidney. So we have to give water tablet to get rid of the water. And then the heart rate, unfortunately, when it starts to feel, it becomes like a horse. When you hit a sick horse, so it can actually go into other conditions and start to try to gallop quickly. So we give another tablet to lower the heart rate, so the heart will have more time to act better.
Okay.
And there's other drugs that we are working on that improve the heart muscle pump action, like ACE inhibitor, or even a new drug called Entresto, which is coming very soon here, and actually it's in Kenya. And those are the drugs which can, which we have studied that can improve how the patient feels and even improve his lifespan. So they live longer if they are on those drugs.
Okay. All right. So the big question is, when does surgery become an option?
Well, surgery is not option at that point, but for the heart failure, we have to know if there's blockage that we couldn't open by stent, then we can think of bypass operation, and that will help. Nowadays, we can put a pacemaker which can regulate the heart and can actually make synchronized contraction in the heart, so that pacemaker can help. Other people, they are trying, and there was a lot of attempt to put another muscle from the back around the heart and to simulate that muscle with a pacemaker. But all these studies, unfortunately, they didn't work properly. Then we have another surgical procedure when we put artificial pump. So it's the same pump that we put on the outside the patient, and he walks with it with a battery. If the battery stops, unfortunately, the pump will not work. It is working. It's called LVAD device, and it's working, but it's very expensive. We have very selected patients in Europe that we put that device, and it's not only to put the device, but you need even hospitals that they trained to take care of those problems. And then the ultimate goal, if nothing working, nothing help, then we have to put another heart or a new heart, which is heart transplantation.
Okay. All right. Before we get into transplantation now, we have a question. And this is Mildred from Dandora. And she's asking, she has blood pressure, and she also has big hernia. And she's asking if she goes for an operation, okay, on the hernia, that is, will it increase chances of getting, is it high blood pressure? No, will it increase chances of her getting heart attack?
Heart attack.
Yeah.
The cause for heart attack, anatomically, we know, as I said, it's a blockage.
Yeah.
But why the blockage happened on that day, on that time? This is that people have been doing a lot of research. Nobody knows exactly what triggered that. But we can suspect different things.
Okay.
Acute stress. So operation, any kind of operation is kind of stress to the body. It's nothing that you have every day. So acute stress, when we have a patient or higher risk patient with diabetes, high blood pressure, angina, they have to see a cardiologist first before they go for orthopedic or operation or hernia operation or anything like that. If there's any alarming symptoms that something could happen in the heart because of the stress, we have to fix the heart first and then we fix the other operation. Except if it is acute surgery, if something like life-saving measures, then we said, okay, we have to take the risk of having surgery. But that's about maybe 15% of our work as a cardiologist, that we have to assess patients going to other kind of operation from the heart point of view, if the heart is strong enough to cope with surgery, or we have to prepare the heart in a different way.
Okay, and then we have 2 questions. Time is not on our side, so we'll try and answer this very briefly. This one says, Simon, when I go somewhere cold, I feel pain in my heart. What could be the problem?
How old is the patient again?
Didn't say their age.
Right. So if the pain coming on exertion, and it is in the middle of the chest or in the back, sometimes it goes to the neck, sometimes it goes to the left arm. So all this, it depends it's different from different patient. But if the patient have severe pain every time he do any physical work, he should go to test himself on a treadmill or other kind of test to see if he has angina or not.
Okay, all right. And then this other one says, I always hear a sound at the neck artery. What could be the reason? This is Stephen.
Sorry, guys.
Says, I always hear a sound at the neck artery. What could be the reason?
The neck artery, some people are thinking they are more observant than others. Like some people, they feel that they have to breathe. But normally we have our heart rate and our breathing is done automatically without actually controlling that ourselves. But some people can hear the heartbeat when it goes quickly, or when they have some problem with the ear, like a blocked ear can hear inside the body more than hearing outside the body. Then she will be able to hear the pulse in the carotid artery or in the neck artery. Sometimes if the blood pressure is too high or the heart rate is too high, then it will be more audible compared to normal state.
Okay, now as we finish, very quickly, what are some of the complications that might arise from heart attack? And then how do we prevent ourselves from getting a heart attack in the first place?
Right. Shall we start with a complication first? Yes. The complication, as I said, it's the worst one is cardiac arrest. Of course, if the patient is in the hospital and he have an access to acute help, then we can save him. If he's not in the hospital, then it will be difficult. So the cardiac arrest is the first complication. Then the second complication, the blood clot inside the coronary arteries, actually it causes scar in the heart muscle, and it builds a blood clot over the scar, and the blood clot can separate from the heart and it can cause a stroke at the same time.
Okay.
So that's one of the things. And then the electric complication, signal is not passing through the heart, or is passing with a lot of arrhythmia, which is fast heart rate or bad heart rate, which is not compatible with life, and that can cause death, both in the acute stage or later on.
Okay.
The worst scenario there is if that scar actually start to increase and it becomes very weak, becomes the same like a balloon, and then if the heart can rupture, the same like the balloon can rupture if you inflate so hard. So I have seen it maybe 3 times, that heart rupture, because of that scar, and then the blood pressure is too high and we couldn't lower the blood pressure, so the heart rupture, and then that's a very deadly situation.
Okay.
We maybe save 1 in 10 people that happen.
Okay. All right. Now, and of course, on the prevention part, we just avoid some of the things that we talked about.
Exactly. The risk factors are very important. High blood pressure, it has to be treated the high cholesterol have to be treated, to look at the exercise, how the way we live, the way we eat. All these risk factors will prevent the heart attack.
Okay. All right. Now, and prognosis of, let's say, someone with a heart attack goes to a hospital earlier enough, gets checked and then treated on time. What is the prognosis compared to a person who delays, seeking treatment, on the scene?
Right. Well, actually, the prognosis sometimes can be much better than the person who never had a heart attack.
Oh, okay.
Because if the patient comes, we said that we come on time to the doctor, and we go to the cath lab on time, and we have a perfect stent or angioplasty done on time and done in a good way, then that patient course throughout the next few months, then we start to treat his blood pressure to very optimal. We start to treat if there's any diabetes. We start to treat his cholesterol level, becomes back again to normal. Man, the other guy who would never have been in a doctor, who has high blood pressure and he doesn't know about that, of course the prognosis of that one who had a heart attack will be actually better than the other one.
Yeah.
If he stick to the treatment and he stick to the new lifestyle.
Okay.
So it's not the end of life, and they will have a lot of patients with that we did stent after a heart attack, and they're doing very well.
Okay. And someone might ask, okay, so how long does it take before someone is okay, in terms of how does it take, to recover? Very briefly, like 30 seconds as we wind up.
Well, to recover from heart attack, it's different if the patient is very active and he stick to our physiotherapy program that we have now for every single patient with a heart attack. Then the prognosis will be very good, and he actually can make a wonderful recovery through weeks only.
Okay.
We always recommend not to fly in the first few weeks, and not to drive a car because of the stress in the street until he knows his body and until he knows this new situation.
Okay.
But if they manage to change the pattern of life, stop smoking, stop alcohol, and lower the cholesterol and the blood pressure, they're doing very well, and it can take only a few weeks.
Oh, wow. All right, Dr. Gabala, thank you very much for coming over today and, of course, helping us understand more on heart attack, and we wish you all the best.
Thank you very much.
You see in Kenya. Of course, thank you so much as well for staying with us till the end of the show. I believe that you have a better understanding of what heart attack is all about. And for those who asked your questions, thank you very much for the same. And I hope that you have been answered to your satisfaction. My name is Winnie Lubembe. On behalf of the entire team who made the show a success, we wish you a lovely day ahead. We'll see you again, same time, same place tomorrow. But just in case you missed the first part of the show, then be sure to tune in tonight at 11 p.m. for a repeat on the same. Alternatively, you can catch the full episode on our YouTube page, and that is on Every TV My Doctor. So see you tomorrow. Have yourselves a lovely day ahead. Goodbye.